Well, thank you so much for joining us here today. Just a little bit about Zeldis Research and who we are. We've been in the market research business for over 30 years, and we specialize in two key verticals, those being insurance and financial services. And nearly all of the work that Jeff and I do is in the health insurance and healthcare space. And we conduct both qualitative and quantitative research. So at Zeldis, every year we do self-sponsored research on emerging issues to keep us up to date in what's going on, and also to have information to share with our clients and potential clients. So back in 2020, we launched our Telehealth for Behavioral Health thought leadership, which was designed to understand the logistics of the move to virtual therapy during the pandemic. So this year, we decided to explore the experiences of those who accessed treatment, behavioral health treatment, for the first time and used teletherapy to open the door to counseling. So really the purpose of this thought leadership is to uncover the impact of teletherapy. And by that, we're thinking about video, chat, text, and telephone, really on accessibility and the customer experience and apps and tools that are used, and really thinking about the future of treatment options and what consumers will be using in the future for their therapy sessions. So with that, I'm going to turn it over to my partner, Jeff.
So as part of the background for why we did this research, we noticed that demand for mental health services has really surged during the pandemic. And on the flip side, there's still many Americans who don't get help for mental health issues. And there's also not enough capacity. There's still so much demand and long waiting times, backlogs for getting mental health access. And we all understood through the pandemic that telehealth, was playing a role here and providing another modality for getting therapy. And we saw some headlines during the pandemic that teletherapy is far more common for general health, but also particularly more common for behavioral health. And we wanted to understand a little bit more of that. So if we jump to the next slide, one of the things that we saw from the Kaiser Family Foundation was some claims data that they had that actually demonstrated some of the headlines that we've been seeing. What they show in this chart here is really that teletherapy has remained at a high level, higher than for other telehealth outpatient visits. So this shows that of all outpatient visits for mental health and substance use, about 36% are now by telehealth. And that's what we're calling teletherapy. And of all the other outpatient visits, those that are not for mental health and substance use, about 5% are now by telehealth. And as the pandemic spiked, telehealth was used more for mental health and substance use than other outpatient visits. And then as the pandemic receded, it came down by half for other outpatient visits, from about 10% to 5%, but nowhere near half for mental health visits. It's at about 36% now. So teletherapy or telehealth for behavioral health is really remaining strong. And again, it's not survey data, it's claims data, so it's really striking. So if we jump to the next slide, for us, that meant we were really interested in 4 guiding questions. Overall, we wanted to understand, what is the teletherapy experience like, especially for new patients? That was our focus, like Leanne said, people who are first accessing counseling, and they're doing it through teletherapy. We wanted to know about effectiveness. Is it increasing access for people who otherwise would not pursue therapy? Can people establish trust in teletherapy? Do they switch to in-person therapy when they first have a chance to do so? And how easy is it to use their health plans to get therapy? And again, of course, future opportunities and challenges. We want to understand from both consumers and therapists what they saw about the future for teletherapy. So the design that we used was qualitative research. We did 16 consumer IDIs, one-on-one interviews, and 8 IDIs with therapists. Our consumer IDIs were split between those with group insurance and those with Medicare Advantage. So we were curious about whether we'd hear about differences given the different age groups for the Medicare population and those who have employer-sponsored insurance. And among our consumer respondents, we recruited them so that they all started therapy recently, and they all had to start virtually. They didn't have to end virtually, but they had to at least have their first few sessions virtually so we could understand what that starting experience was like and if they stayed with virtual therapy. And then again, among our consumers, we have a pretty good spread in terms of ethnicity and gender, and you can see the different carriers that our consumers had in this study. Some of the Blues, United Healthcare, Aetna, United Healthcare again, Care Plus, and we had a fair amount of regional spread, but again, it's a small number of interviews, so it's not national for sure. Among our therapists, we talked with a mix of counselors, psychologists, social workers, and so on. We recruited them so they had to see at least some patients virtually, but not be solely virtual. And we wanted to talk to people who were mainly seeing, mild and moderate issues. And you can see sort of the range of states that we had represented among our therapists. None of our therapists in this study, worked for a teletherapy firm. They didn't work for BetterHelp or Amwell, Talkspace, and so on. So we'll have more about them as we go on. We did 30-minute phone interviews. Leanne and I were the moderators, and we fielded this in the spring of this year. The usual caveats apply to this qualitative research about small sample sizes and using this for directional results. So our real focus again about access is teletherapy increasing access for people who otherwise would not pursue therapy? Is teletherapy just substituting people who would otherwise go to in-person therapy? Or is this truly giving access to people who might otherwise not try therapy? We were really interested in that for people who were sort of new starts for therapy. We jump to the next slide. Here's one quote that we think is emblematic of what we heard. And this is from a therapist around that question of access. Just like the Kaiser Family Foundation claims data, most therapists were telling us they're still seeing many patients virtually, including new patients who just start virtually, who have no issue with that. And they're telling us they're seeing people who they think might have fallen through the cracks and not otherwise pursued therapy. These are folks, like this therapist tells us, who they have a newborn, they have 3 kids. It's not easy for them to go to therapy. They may be college kids who normally would not get counseling during the school year because they moved to a new town, and it's just a discontinuation of their potentially previous therapy. So their therapists were telling us they're seeing new people who otherwise wouldn't have accessed therapy. We jump to the next slide. What consumers told us was largely the same. They described teletherapy as really having some advantages that nudged them to get therapy. It removed potential barriers and increased the chance that they weren't derailed. In a sense, it's like what we hear from behavioral economists who talk about nudging people to do certain behaviors. That's what we heard from consumers here. And we have one quote from a consumer with group insurance who sort of symbolized that. She said, "I thought about getting into therapy, but I knew I didn't have the time to go in person. I was working full time and doing grad school at the time. The grad school, were offering free therapy through BetterHelp, and I appreciated that it was so easy and so accessible to me, and that's what encouraged me to get into it." So it really just helped nudge them along and remove potential barriers that we'll talk about. On this slide, we wanted to try to articulate what we heard were the nudges. What were the barriers that were removed? What were the things that helped move people along so that they didn't get derailed? And we think these are some of the issues. They may not be surprising, but I think it's helpful to see them all in one place, that teletherapy, as opposed to in-person therapy, fits life easier for many people. There's geographic factors, cost, mobility, and efficiency issues. In terms of fitting their life, we heard many people say that it just was easier than in-person therapy. And we have one example of an illustrative quote. We had one woman say, "I don't have to look for parking. I don't have to sit in traffic. I don't have to do PTO and then have to talk to my boss. I can just put on a pseudo meeting and then just work extra. While I'm working from home, that's just easier." And one thing we learned from consumers and we thought about ourselves is that this sort of convenience factor of fitting life, it's not a small thing when it comes to mental health, to behavioral health. Usually people going for behavioral health are going for several sessions, sometimes many sessions. So it's not a one and done like a non-mental health telehealth visit. It's very different if you have a skin rash and you want to see a dermatologist over telehealth and you see them once and they say, yep, that's poison ivy. And then you're done and you don't go back to that person the next week necessarily. But for behavioral health, it usually involves, weekly appointments or monthly appointments repeatedly. So those small inconveniences really pile on. And we heard this especially for parents, whether the patient was the parent themselves or if they were the caretaker of a child who was in therapy. Those inconveniences really piled up and made it difficult to pursue therapy, to think about therapy, unless they were doing it through teletherapy. As another part of fitting life, we heard from a few people that there was less stigma for them doing teletherapy. We had one group consumer again say, what makes me a little bit uneasy about going to therapists is that I'll wait in the waiting room and I'll see somebody I know, and that they know somebody that I know too. Teletherapy eliminates that possible awkward exposure. So it's just another bump in the road, another thing that can be removed. We heard a lot, particularly from Medicare consumers, about geography, that the geography of teletherapy widens the geographic reach to find a therapist who's a good fit, or separately to find someone who's accepting patients with their insurance. So one Medicare consumer told us, with teletherapy, the whole country is open to you. If you try someone and they don't work, there are thousands of other possibilities. They might be in California where 6 o'clock for them is 9 o'clock for you. And this was a gentleman who wanted evening appointments, and that sort of West Coast, East Coast difference really mattered to him. We heard several people talk about lower financial costs with teletherapy. They talked less about the copay and they talked more about parking and gas, maybe in this environment we're in right now, but those added up, those cost factors, and teletherapy helped them with those issues. And we also heard some people talk about lower copay to do teletherapy than in-person therapy. We had several who also talked about mobility issues. One person was in chronic pain and dealing with chronic pain with a medical doctor. Doing teletherapy was a good option for her. We had several who had transportation challenges. One was a rural consumer where there weren't many therapists nearby and a long drive was involved. Another was an urban consumer who said that she took the bus to a train to get to the therapist, and this was just easier to do teletherapy. And again, it makes a big difference when you multiply it by 20 visits or so. And then lastly, in terms of the efficiency, if people had to cancel or reschedule on short notice, it was much easier to do for a teletherapy appointment than an in-person appointment where they needed a lot of lead time to get somewhere. If we jump to the next slide. Another factor about not getting derailed from therapy was about continuity of care across states. And this surprised us. We learned about this from therapists who talked about how important it was to them that during the pandemic, many therapists were allowed to see out-of-state clients. Typically they could only see patients in state, in the state where they're licensed. But when restrictions were relaxed during the pandemic, they could continue to see patients, and that continuity of care was really important. We had, one therapist, we actually had a couple of therapists who see college students, and they really highlighted how much more complicated getting consistent care is for college students. This one therapist said college kids would not generally get therapy during the year. Counseling centers are overwhelmed. And when a student goes to a new town, if they're 18 or 19 years old, it's really hard for them to find their own therapist. So for this therapist, being able to continue her therapy when the student left for college, she felt was really important. She also highlighted that when students come home for summer breaks or for vacations, she said that's often the most difficult time for many student age consumers, and a critical time for them to continue having therapy. So if they have a therapist in a college town, but then they go home to another state and they lose that connection, it's another opportunity to fall through the cracks. We jump to the next slide. Another issue about not getting derailed that therapists told us about was about agreements across states that some of their professional associations have developed. So psychologists in our sample told us about PsyPact, which is an agreement for psychologists, not for social workers, not for counselors, that allows them to practice across state lines. And you can see how far those agreements have reached to this point from the map that we're showing there. So we had one psychologist in Delaware, a tiny state surrounded by a lot of other states, who said it was critical for her that she could practice across state lines because she had many clients who worked in Delaware but lived somewhere else. And she could do that because she was a psychologist and her state is part of PsyPact. As a contrast, we had a psychiatric therapist in Maryland who was not part of PsyPact because she's not a psychologist. And she highlighted that, when the state of emergency ended, they were no longer able to see patients who were not in their state and under their license. So she was really troubled by having to refer patients out or trying to manage patients who would be willing to drive over the state line into Maryland, sit in their car, give them their location so that they could do therapy. And we've heard about some other roles developing things similar to PsyPact. We've heard about one among counselors, but these are, initiatives that these professionals are trying to develop. Jump to the next one. Around effectiveness, we really want to understand two questions. One was, given the importance of a therapeutic relationship for behavioral health and trust, is there any unique difficulty in creating a therapeutic relationship by teletherapy as opposed to in-person therapy? That was one question we had about effectiveness. And the second one was a real practical one, just among people who started therapy through teletherapy, did they stay with it? As pandemic restrictions eased, did they switch to either hybrid or in-person therapy and say, this just isn't the same, I really need to switch? Did they or didn't they? We're just curious in that sort of outcome. So if we jump to the next slide, here's a quote that's really symbolic of what most consumers told us. The large majority we talked to told us they had a question in their mind about whether or not teletherapy would work for them. But really, once they started doing teletherapy, it was a non-issue. It happened easier than they expected. Most did not have to keep trying therapists to get a fit. It just seemed to work out organically. So here's this one consumer who said it was definitely something I was concerned about going in. Then once I actually started and we were face-to-face on screens, I was surprised at how easy that was. My concern fell away and we could still have a connection and good sessions completely online. And we had, repeatedly consumers told us that, how much easier it was than they expected. We had a few of our Medicare consumers who had actually had therapy more than 10 years ago, and they had had in-person therapy then. And several of them said that they were also surprised at how easy it was to establish a relationship and trust just by doing teletherapy. Sorry, Leanne, if we jump to the next one. When we asked therapists about that, we were really curious because they've all been trained to do in-person therapy and they've made this recent shift to doing teletherapy or doing both. And we thought that most of the therapists we talked to would talk more about how difficult it was to have the same kind of relationship. But in fact, all but one of our therapists, 7 of the 8, sounded just like the consumers. They said that they were surprised at how easy it was to establish that relationship. So here's one therapist that symbolizes this view. She said, I was anticipating a great deal of difficulty in building rapport and connecting with new clients, and it's been virtually no different than if they were in the office. In some cases, I think the connection's been made faster. So we were just really struck by that. And we heard that same perspective 7 out of 8 times. You jump to the next one. We had one exception, a therapist, which is always good to hear and qualitative, to get an outlier, because you never know how common that can be. But this outlier really said that it was more of a challenge. Her quote is, "Therapy is based upon a very intimate relationship between the therapist and client. It's difficult to create that kind of relationship online because there's obvious distancing. It's a buffer between me and the client." She had a very different approach than the other 7 therapists we talked to. And we have a hypothesis about that. We don't know for sure, but we think that it may be related to the kind of therapy that different therapists or counselors use. There are different approaches from more brief and more cognitive focused therapy to more emotional or psychodynamic approaches that focus more on the unconscious. And this therapist, who was the exception in our group, was more of the latter, who focused more on a psychoanalytic approach and more about what's outside of the patient's consciousness. So that it may differ based upon therapists' approaches to how they do therapy. So again, to pull together some other things we heard about effectiveness, one issue is around trust, and we really heard most people say that was not a challenge. One thing we heard that was a real positive for teletherapy was that some patients feel more relaxed in their own space. They're more relaxed, they have an easier time opening up in their own space, and that was especially adolescents. So we had therapists highlighting for us that they thought teletherapy maybe worked better for adolescents. We had one therapist really articulate that well. She said, adolescents, they can sit in their bedrooms, sit in the dark if they want. Sometimes it's the environment of being in their space versus my sofa that's more comfortable and makes it easier for them to open up. She said, "I'm seeing more adolescents that see the need to be there themselves as opposed to being dragged in by their parents." And I thought that was really striking. Rather than having, mom and dad or some parent waiting outside or waiting out in a car, they're doing it themselves. They're motivated, and they're in their own space. And for some, it's just easier to do it that way. We also heard about sort of the social aspects of teletherapy. For some the patients that we talked to, they were clearly aware of their own struggles with social anxiety or with COVID anxiety during the height of the pandemic. And those kinds of issues made it uncomfortable for them to leave home, and they really appreciated teletherapy. So in that sense, it was a positive. If we jump to the next slide, lastly, around effectiveness, we also just asked people directly on a scale of 1 to 10, teletherapy is the worst approach for me or best approach for me. And we were surprised, 10 out of 10 that we asked said it was the best approach for me. We got 10 top 3 box responses. And here we did see a difference between Medicare and group consumers. And it was surprising for us. The Medicare consumers gave the 9s and 10s. They gave the highest responses. It was the group consumers who gave the 8s, where there's some qualification, there's some caveat for why it's not just perfect for them. So even with our stereotypes of older Medicare consumers maybe having challenges with technology or not being comfortable with it, at least the ones we talked to in this study, they were very happy with it. It was working out really well for them. And I'll turn it over to Lee now to keep talking about what we learned about effectiveness.
Great, thanks, Jeff. Okay, so of course we wanted to know what's the current situation and what are these consumers currently doing in terms of accessing therapy. And so among the 16 consumers that we spoke with, we found that most, 12 of the 16, are still virtual or hybrid. 2 recently stopped therapy, so if we take them out of it, 12 of the 14 are still virtual or hybrid. We did see a difference here when we looked at Medicare versus group consumers. And so among our 8 Medicare consumers, 1 stopped going to therapy and the other 7 all stayed virtual. So none of them went to in-person. Now that could be maybe they're more concerned about COVID and want to stay home and not go out. It's interesting because we do often think about our older population and perhaps their hesitation with technology. But I think that's one thing we've seen over the course of the pandemic, that they really started using technology to connect with their family and see their grandchildren. And so we see this here, that our Medicare consumers are comfortable with teletherapy and continue using it. So our group consumers, looking at those individuals, so 4 switched to in-person or hybrid. And a couple of them just told us that they wanted to see what in-person was like. Again, they started with virtual, so they hadn't been in person. So they wanted to try it out to see if they liked it better, but they weren't really sure what their preference would be. We did hear from one consumer, and she has a tic, and she was very self-conscious being on video. She said it was difficult to not speak over the therapist, and she had a lot of trouble with that. And she thought that it would be easier for her in person to read those cues and have an easier time. So she did switch to in person. So it was interesting hearing different stories and reasoning behind their preference. Thinking about the therapists and what they see in terms of whether they're continuing virtual or in person, all of our therapists told us that they expect to continue at least some teletherapy. And most are currently continuing to see their clients and patients via teletherapy. Most do expect to have a hybrid approach. Only one told us that they expect to be solely virtual moving forward. We think this quote was representative of what we heard from our therapists, and particularly thinking back to 2020, we heard this reluctance in terms of starting teletherapy. So I was very reluctant to start teletherapy, but I am now a serious advocate for it. At the moment, I am 100% telehealth, and I'm hoping to keep it that way. There are some clinicians in my office who are doing in-person stuff, but most of us are telehealth. So it wasn't just her experience, but also for her colleagues as well. They were continuing with teletherapy and really found benefits for their clients and also for themselves. There are some challenges that we heard about. Interestingly, there wasn't 1 or 2 overarching challenges that came up often. For all of these challenges, it was a few mentions that came up. So first, thinking about physical distance and trying to create a connection with the therapist. A few of the consumers told us that was difficult for them to create that connection, but really for many of them that wasn't a problem as Jeff shared. As I just mentioned, some indicated that it's harder to read those nonverbal cues. So that was an issue for some of them. A quote here: sometimes he can't see fully my expressions, and he asks me because I don't verbalize, and maybe I'm off of the camera. So that can be a problem. As we all probably know, technology doesn't always work as we would like it to, and there are glitches, but also thinking about access. For individuals that live in rural areas, they might not have Wi-Fi that works well for them. So that can be an issue. But we did hear that when technology problems arise, they did not spend any time trying to troubleshoot. They just got onto the phone and continued the session. They didn't want to spend any of their time trying to fix the problem with technology. Distractions was also an issue for a few of the consumers. They told us it was harder to stay focused on their screen. They might be tempted to look at their other monitor if they had it up, or look at their phone, whereas they wouldn't necessarily do that if they were in an in-person session, and other distractions outside with a landscaper or the doorbell ringing. So distractions were a problem for a few. Also, privacy came up a bit. We certainly heard more about this in 2020, so it seems that people have found a way to work around this, but some still told us that it was hard to find a spot in their home to have a session. They were perhaps worried about their spouse hearing them on the phone with their therapist, and so that was still an issue for a few. And a few also told us that they did therapy that wasn't as easy to execute through a screen, such as art therapy or playing games. That was an issue for some as well that came up. So some of the challenges that we heard about, but again, for the most part, there weren't really many issues. We did hear from the therapists about times that they didn't feel that teletherapy was the best approach. So if someone was in active crisis, the large majority of the therapists told us that they really thought that crisis mode is better handled in person, and teletherapy isn't the best way to approach that. Also, when working with young children or individuals with ADHD, it's more difficult to keep them focused and paying attention. One quote here from a therapist: he would be doing somersaults on his own sofa. It was hard to bring him back to the screen. He's very well redirected in sessions, but it was hard to do that through a screen. He needs a little more support. So that can be more difficult. And then also thinking about clients that have social anxiety. Some of the therapists told us that them staying in their home and not coming to an in-person session is actually counterproductive. And part of their treatment is getting them out of their house and out of their comfort zone in their own environment. So that was another example of a time where teletherapy wasn't considered to be the best approach, at least for every session. One quote here from one of our consumers with ADHD. She said, as someone with ADHD, it's really hard for me to stay on one screen. I want to be totally engaged, but I can't help it. I feel like if I were in person, I probably wouldn't have so many distractions. So again, thinking about the difficulty of staying focused. And now our next section will take a look at health plans and working with health plans to access teletherapy. So thinking about the health plans represented, we see here, Jeff shared these with us in the intro. So here's some of the plans broken down by group and Medicare consumers. On the therapist side of things, we learned that none of the therapists work directly or closely with payers. They mainly have office staff who handle the billing, so they weren't really doing that themselves. And most did not accept insurance. They would have their patients pay out of pocket and then give them a receipt for them to submit for reimbursement. So, you know, they do hear if any health plans are easy or difficult for patients to work with. They do get that feedback, but they don't have that direct experience themselves. So how do consumers search for a therapist? We heard a variety of ways here, and this is a pain point for many consumers. So I'll be talking more about that. But before I do, just to think about how they're trying to find a therapist. Most told us that they called their carrier or used their carrier's website, and we'll hear about some issues there. Some talked to their physician to get a recommendation, and that was particularly the Medicare members that we spoke with. They were more likely to ask for a physician recommendation. And then we have some other ways that they searched for a therapist. A couple of them went to Psychology Today, that database. A couple of them said that they were proactively contacted by their carrier, and both of these individuals were Medicare members. And one quote from a gentleman that we really love. Anyhow, one morning I woke up, I was very depressed, and it was very unusual. I swear, 2 hours later, the phone rings, and it's United Healthcare, or it might have been one of their agents, saying, we're starting this online therapy. Would you like to participate in it? I said, did you put a chip in me or something? How did you know that? I said, sure, of course. They gave me 8 weeks of a therapist and 7 weeks of a life coach. So for both of these Medicare members, it was very impactful that they were contacted by their carrier. And we know that Medicare members may be more likely to have a care manager or someone at their insurer that's working with them, but communicating access to teletherapy was very important in these cases. And then for our group members that we spoke with, they had some other ways that they learned about the therapist that they were working with: school referral service, recommendation from family and friends, better help, and some other ways there for our group members. So as I mentioned, finding a therapist and getting an appointment can be a pain point. And there are a number of things impacting this and making it difficult for the consumers that we spoke with. Inaccurate carrier directories, and we often hear about this in the research that we do, that the directories aren't up to date, that the therapists are not accepting new patients. So we certainly heard that here. We also heard that there were times when it was difficult to get an appointment. They had to wait a long time, and they really wanted an appointment sooner than they were able to get one. Another gap was in terms of the directories found on the insurer website. They felt that they didn't have enough information to select a therapist that would be best for them. They would like to have had a picture of the therapist, a personal description, including demographics, specialization details, the information about the therapist. One quote here from a group consumer: "It took me about 2 weeks to find the therapist I wanted. I wanted a therapist of color, and then about 5 weeks until the first appointment. There were only 2 to choose from, and only 1 was taking new patients." So if there was information that was helping them make that decision, that she felt that it might have been easier for her. And we also heard that sometimes the information on the site wasn't easy to find. So that was problematic for some. We also heard that some hadn't tried to use their carrier website recently, and so they weren't really sure how it worked. It didn't work for them back when they were trying to find a therapist, but they admittedly said that it could have changed. And so in one of our interviews, the respondent actually said, "It didn't work for me back then, but let me see right now," during the interview. And when they went to the site, they noticed that there were all of these changes, and it was much easier to find the section of the website and to search for a therapist. So just a reminder how important it is to communicate to members when changes to technology are made, because she was going through BetterHelp and actually paying out of pocket for her therapy sessions because she did not go back to her carrier site to find a therapist in network. We also heard from a couple of Medicare members issues with United Healthcare's Able To. So, we heard here that for one, it was very difficult to get it set up properly, and they weren't provided the right number of sessions, and that wasn't working out, and there was a lot of difficulty. So this individual, he said that all the bugs weren't worked out of it yet. Another experience from a Medicare consumer was that the therapist was actually sharing that they were having a tough time providing care to their own clients. They said, I'm having a tough time with this. I don't like my job. And this was what the therapist was telling the client. And he told us, I get a phone call an hour before a session from the company saying that she just quit and they were really sorry. They got me another therapist. So again, a couple of issues with Able To there. In terms of cost and coverage, for many of the consumers that we spoke with, they told us that cost and coverage from their insurer was really meeting their expectations, and they weren't having issues. Most of the consumers told us that they have a small copay through their insurance, that the teletherapy was covered. Some of them did pay out of pocket, as I mentioned, and then submit the bill for reimbursement, but really they didn't have issues with that billing process. It really worked seamlessly for them. A few of them did have to pay for out-of-network providers, and because they weren't able to find an in-network provider, or that it took too long to get an appointment, and so there were struggles, and really, so they decided to go with an out-of-network provider. So now, of course, we want to know about the future of teletherapy and what consumers and therapists expect in the future and what they anticipate doing. So really, we heard consensus that the availability of teletherapy reduces barriers for consumers, and as we said, even prompts some to receive treatment who otherwise may not have. So really, all agree that teletherapy is here to stay. The ease and convenience of it, that it's less intimidating and easier to start than even in-person therapy. The affordability of it is an obvious advantage. And as Jeff was sharing, removing that stigma, which of course would be wonderful if it wasn't there to begin with. There shouldn't be a stigma around mental health care, but there still is. And for some, really overcoming that through teletherapy is an advantage. So one quote that we think is representative of what we heard from a therapist: "I don't think we're ever going back. We've all seen that it's good for the patients. We now have access to patients who may not have otherwise sought treatment. It's good for our clinic, it cuts down on no-shows, and increases our productivity level. There's no going back now." So thinking about that, there are a few opportunities as we see them, particularly related to platforms that are being used. So just some thoughts that we pulled together here. We did hear from a few consumers that they don't like seeing themselves on the screen, and that made them uncomfortable. So increasing the choice for how a video picture is positioned would be welcomed so that they could adjust it to their own comfort level. Having lockable screens so that patients can't surf or look at something else during a session would be valuable. Perhaps built-in tech support. As I mentioned, they aren't troubleshooting during the session, but if there was built-in tech support, they would stay online and continue rather than going to phone to finish out the session. And then thinking about tools that support interaction and increase engagement online. Thinking about music and art therapy, or effectively engaging and gaming with a child online would be welcome and make it easier for the therapists. And then, of course, there's the question mark around regulations and legislation. And we don't know what will be happening in terms of whether regulation and legislation is going to shrink or expand teletherapy access. And then, of course, as we know, we heard this in 2020, and again, this came up, therapists are concerned about their reimbursement rates, and they firmly believe that they should be reimbursed at the same rate for teletherapy as for an in-person session. So that is a concern to them. So at this point, I'll pass it back to Jeff.
Thanks, Lee. So just to summarize, around our question about access, is teletherapy really increasing access or just substituting people who would otherwise get therapy? It seems from this qualitative research that it really is increasing access. It's opening doors to new people. And the reasons we heard were, again, easier fit into their schedule, less stigma, no travel time, it widens the geographic reach, it offers continuity of care across states. And again, that teletherapy session is not a one and done visit to a provider. It's multiple visits, sometimes weekly. So all of those things really get multiplied. In terms of its effectiveness, for most, we heard that it is very effective. It seems to happen organically, establishing a therapeutic relationship. It's surprisingly natural. Some patients feel more relaxed and have an easier time opening up in their own space. And we heard that from therapists that they think it's the case, especially for adolescents. Most of the patients we talked to, they felt a connection with their first therapist. They did not need to switch therapists to feel more comfortable. But of course, it has its challenges. It's not a fit for everyone. We heard about that being the issue for young children, for some with ADHD, for some who didn't have privacy at home, and for some, it's just a personal preference. In terms of its staying power, most 12 out of 16 stayed either virtual or hybrid. And among our Medicare consumers, they seemed slightly more favorable than the group consumers, the younger consumers. And therapists certainly believe that it's going to continue to be part of their practice. What we heard about health plans, as Lee was pointing out, is some challenges that could help. We heard about inaccurate directories and other derailment risks, like therapists not accepting patients, long waits for an appointment, lack of the kind of biographical information on therapists that they want to see, even some confusion on where to find behavioral health on the website. For most, cost and coverage meet their expectations. We didn't hear that really as a pain point. Cost and coverage was okay. It was more about searching for therapists, finding a therapist, finding the right fit, particularly if they were looking for someone like them and they were part of a diverse group. It was really more of a challenge. And then in terms of the future, as Leanne mentioned, therapists in particular worry about reimbursements and whether or not that's going to change. And some of our other future opportunities are on the next slide, if we jump there just to finish up. It can help in terms of the future and opportunities for improvement if it's possible to expand provider networks and improve the ease and use of the behavioral health sections of websites and making it easier for people to do the search and find the right therapist. It's still a lot of legwork for clients, for consumers. Around education, there's an opportunity to increase communication about how teletherapy can benefit members, especially high utilizers of medical coverage, caretakers and other populations that may have an increased need for mental health support. We had one consumer in this study who had a lot of chronic pain, and her carrier reached out to her and made sure that she was connected through teletherapy if she chose. And that was really meaningful to her. That kind of proactive outreach and education seems important and very effective. There are opportunities to innovate around platform issues and address some barriers. We heard about barriers several times for doing therapy with children. And we heard about some challenges still with on-screen distractions, abilities to focus more, and finding more therapists of color and additional language capabilities. And then lastly, health plans, carriers can help advocate for additional legislative initiatives to try to maintain and grow access to teletherapy, including that cross-state access that therapists said was crucially important for them. So thank you. That summarizes the research we did. We hope you found it interesting. I'll turn it back to Brad.